Medicare Part D. What is it? I already have A and B, and I have a Medigap plan. Doesn't that cover drugs anyway? I mean, right here it says Part A and Part B, they cover drugs too. But wait, I found out what the best way to think of Medicare Part D is. Now, this is not by any means an official statement from CMS, but if you think of Medicare Part D as pharmacy insurance, your life will be much easier. Now, let me explain. So, Medicare Part A covers drugs when you receive them in the hospital. Now, these drugs are obviously still prescribed to you, but they're not covered under Part D. Medicare Part B also covers drugs when they are prescribed to you in the doctor's office and a physician administers them. Now, there's a list of drugs that can only be obtained through Part B, but we'll go over that in a separate video. And if you have questions about Part B only medications or Part B drugs that are also covered under Part D, leave me a comment. Then there's Part D, prescription drug plan. So based on those types of information, you would think that a Part D plan would be optional because Part A and B cover those two medications or those two ways of getting the medications. But there's a third way you can get the medications, and that's through the pharmacy. And that is the only place where Part D actually works. So I like to think of it as pharmacy insurance. Now, for pharmacy insurance or Medicare Part D, they have 4 coverage stages, and they work completely independent of your Part A and B services. So if you have a Medigap plan, completely different. If you have a Medicare Advantage plan where the drug plan is included, it is still and should still be thought of as separate. Now here's why. So Part D, pharmacy insurance, Medicare prescription drug plans, they have 4 stages of coverage. The first stage of coverage is the deductible phase. Now that phase or stage is up to $445 of money you have to pay out of your own pocket before coverage actually begins. Sometimes though, during the deductible stage, they have drugs in lower tiers typically that are not subject to the deductible. And also, some of the medications are actually less than the copay. So even during the deductible stage, you'll be paying roughly the same amount even when you're in stage 2, which we'll get into right now. So stage 2 is what we call the initial coverage stage. And this is where all the listed tier 1, 2, 3, and 4, and 5 co-insurances or copays are observed. Meaning, if your plan has a tier 3 copay of $45 and you paid your deductible, you will be paying $45 per month for this medication. Now this stage lasts until you hit a certain amount of both your own money and the insurance company's money, which is usually listed here. And this number changes every year. And this is the initial coverage amount or limit that you have every calendar year. Now, once that number is met by both, of course, you and the insurance company combined, then you go into what's called the coverage gap or the donut hole. Yes, it was supposed to go away, but it really didn't. It's still there. They just say it went away because the price changed a little bit. As of 2020, 2021, when they finally completed the shift to the donut hole or their elimination of the donut hole, the cost of medications during the donut hole or during the coverage gap is limited to 25% of the drug's cost. Now, 25% of the drug's cost can be phenomenally expensive or extremely cheap, depending on your medication. So it's really important to go through this exercise that I'll go into another video on how to make sure you're getting the best prescription drug plan for your current prescription medication. But during the coverage gap, you have a period of, unfortunately, 25% co-insurance on most of your medications. Now, to get out of the donut hole or out of the coverage gap, you kind of have to spend a whole lot of money. And what is called is the true out-of-pocket cost. And they changed this again in 2020 when they revised the donut hole. by using a different formula to calculate how they, Medicare Part D pharmacy drug plans, calculate or come up with the true out-of-pocket number. Before, it used to be that only money that came out of your pocket counted toward this TROOP, this true out-of-pocket cost. But in 2020 and 2021 and 2022 and for the foreseeable future, they add back or they add to your out-of-pocket expenses 70% of the drug costs. And that 70% is supposedly the prescription drug manufacturer's cost or their rebate towards the cost of your drug. Now, I know this is very frustrating, it's very complicated. They want everyone to understand this, so I'm sorry you're watching this video. But pretty much know that when things get plugged into the pharmacy calculator, that's really the best estimate we're gonna get. And many times, if you're on really expensive medications, especially if you're on at least 2, we're gonna have to figure out what the best plan is, and it's not gonna look pretty. We're probably gonna go through the donut hole and into the next phase, which is the catastrophic phase, which is as terrible as it sounds. It's better than being stuck in the coverage gap. So let's go to the catastrophic phase. In the catastrophic phase, you go from paying 25% of the drug cost down to 5%. And that is, not many people reach that catastrophic phase, but that's kind of the phase that you are going for if you're in the coverage gap, because most people end up in the coverage gap, stay there, and then January comes around and it's all over again. But if you reach the catastrophic phase, it's actually a blessing, because now instead of paying 25% for the medication, you're paying just 5%. And that ends the 4 coverage phases or stages of Medicare Part D. Now, I know that was a lot. Medicare Part D, unfortunately, isn't very easy to understand. Fortunately, though, they have tools, or at least I have tools, that can make this a little bit more understandable and relatable based on the medications that you have. So if you want to find out if you're on the best Medicare Part D drug plan for the next open enrollment or annual election period in October through December, send me an email, let me know, and we can get you set up on a schedule so that we can do that kind of analysis. If you, though, want to do it yourself, you can. Medicare.gov offers you a free way to evaluate all the Medicare Part D or pharmacy drug plans in your area. If you wanted to use mine, you can go ahead. All my clients who use that link will, of course, get access to being my client and having a little bit more one-on-one time with me in deciding and evaluating their Medicare choices. I hope that helps figure out how to get and how to, evaluate the Medicare Part D or pharmacy drug plans. I'll see you in the next video.